A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors. The Office of Disease Prevention reports that millions of Americans have some type of blood disorder. Some may suffer from bleeding and clotting complications, while others may have a genetic disorder like hemophilia or other concerns. On this edition of your Hometown Health Connection, we'll introduce you to an organization with medical experts right here to help. I'm John Schaefer in for Samantha Latshaw. Welcome to your Hometown Health Connection. Western New York BloodCare, formerly the Hemophilia Center of Western New York, is a not-for-profit licensed diagnostic and treatment center and a chapter of the National Hemophilia Foundation, offering a variety of specialized health maintenance services for persons with blood disorders that require lifelong medical management. Now, through its clinical services, advocacy, education, and research initiatives, Western New York BloodCare strives to improve the quality of life for people affected by these conditions. Joining us are Dr. Beverly Schaefer, a hematologist specializing, by the way, in pediatrics and young adults, and Laurie Reger, the executive director of Western New York BloodCare. Welcome, ladies, to your Hometown Health Connection.
Thanks so much for having us.
You're welcome. You're welcome. So, Laurie, I want to start with you because we offered some background on the Western New York BloodCare Center, noting that it got its start as the Hemophilia Foundation. But how common is hemophilia and why the name change?
Well, hemophilia is not very common. It was founded 50 years ago by one of our families to help increase awareness and treat these patients on a more routine basis. And what we found is predominantly in the male, but as the treatments evolved and more diagnostic testing became available, we were finding patients, not just males, had bleeding disorders, but there were numerous bleeding disorders, and it was in the females as well. And we recently opened a clinic for girls, and known as the Hemophilia Center. When they would call to make appointments, and we answered the phone as the Hemophilia Center, they felt they had the wrong number. So we knew it was time at that point to branch out and rebrand, and therefore became Western New York BloodCare.
So, Laurie, you really took something that, growing up, I heard of hemophilia, as did many people in my age, and so you really kind of moved it forward, made it contemporary, and opened it up with an umbrella for everything that you have available to you as a service.
That's correct.
Yeah. Mm-hmm. So, Dr. Schaefer, now tell us about the other blood disorders. We talked a little bit about hemophilia with Laurie, but tell us some of the other things that you care for, because some of these I had not heard of until I got into the research for the show. Why don't you talk about some of them?
Sure. So I think most people are pretty familiar with hemophilia, which is often one of the most severe forms of a bleeding disorder, but there's numerous other mild bleeding disorders that are out there. One of the more common ones is something called von Willebrand's disease, which can also run in families and affect males and females. Other families are affected by rare clotting factor deficiencies, problems with platelets, and also another problem known as Gaucher's disease. But that's just one side of the spectrum. The other side of the spectrum are patients that we care for that may be prone to blood clots, patients that need chronic blood thinners or anticoagulation. And sometimes there's actually a hereditary or a family factor or family kind of tendency towards these conditions as well.
And I noticed another one here, thrombophilia, is that?
Yeah.
What is that?
So thrombophilia is the general term that we use to describe a risk factor for a blood clot. And this can be something that you are born with, or it can be something that you acquire in your lifetime.
Now, sometimes I will get, in the middle of the night, that leg cramp. What is that, a clot? What is that exactly?
It's probably not a clot. That's probably just a little bit of a muscle spasm. Some people call it a Charlie horse. Yeah. But that would be unlikely to be a blood clot. A blood clot does not get better on its own. It gets worse.
And Laurie, I know we talked about some statistics that there are as many as 3 million people in the United States that are impacted by bleeding and the clotting disorders, as we just mentioned. But how many people do you serve at Western New York BloodCare?
On an annual basis, probably 300 patients that we have, but there are several that are out there that aren't even aware that they have bleeding disorders, and we're getting new patients weekly that come in.
And we should mention, Laurie, we talked a little bit before we recorded the program, when you hear about getting blood work, people have that for various reasons. Maybe they're diabetic or there's something wrong in their system. That's not what you do, but if you get the blood work and there's something that's found, then you take it over from there.
That's correct. We do have an on-site laboratory. It doesn't just do routine blood work, it's special testing for these bleeding or clotting disorders.
So Dr. Schaefer, just talking about that, what are some of those challenges that somebody who has a bleeding or a blood disorder, what do they face, and how do you help them with advanced treatments at Western New York BloodCare?
Sure. So some of that really depends on the type of bleeding disorder that's been identified in this person or in their family. So you can imagine that a lot of what we do is symptom management. So if you're somebody who has a mild bleeding disorder, then maybe I'm going to help develop some strategies to help you manage your nosebleeds so that you don't have to get taken out of, your history class all of the time to go to the nurse's office. Women in particular really suffer from bleeding related to heavy periods, and this can be really debilitating for a lot of women and really affect their quality of life. So we often help women develop strategies to manage their heavy menses. Another situation that we do a lot of preparation for is surgery. So even something like a minor surgery, maybe a minor dental procedure that for you and me would be pretty simple, for someone with a bleeding disorder can be a really big deal. So we spend a lot of time adequately preparing our patients and their providers for if surgeries are needed. And that's both when we have the opportunity to plan for them, an elective surgery, but also having backup plans in place for when emergencies happen as well.
And talk to me about some of the advancements in treating blood disorders really over the last 10 years. And obviously the technology for all kinds of medical treatment continues to get better, but talk to us about some.
Sure, I'll specifically highlight some of the advances that are happening in hemophilia, specifically severe hemophilia. So these individuals are what most people, I think, have a picture of in their head, which, 50 or 60 years ago, our options for treating males with severe hemophilia was quite limited. These individuals suffer from recurrent bleeding into joints and to other parts of the body. And in the past, these folks would need to come to the hospital to receive factor replacement from blood products like plasma or cryoprecipitate. Over the past several decades, we've made major advances where now we can give them back exactly what their body is missing in the form of what's called a factor concentrate, a very small amount of medicine that has to be delivered still into a vein, but can be done at home. But the burden is still significant, and we recognize that. So for some individuals, we now really emphasize preventative treatment, but these folks are giving themselves an IV infusion maybe 1 to 3 times a week, depending on the age of the patient.
I'm sorry, I didn't mean
one
to
more thing I'll just mention, but this is great therapy, and there's many choices available for patients, but what's really kind of pushed the envelope is now we have some alternative therapies, including some that are delivered what's called subcutaneously, or just under the skin, like a diabetes medicine might be, maybe once a week. So we're really entering into a very exciting arena for these disorders.
When I was younger, somebody who was diagnosed with hemophilia felt like they had to just become a hermit in their own home and couldn't do anything. And we had discussed that now you can actually have more of a normal life.
Absolutely. So with these different advances, both what's called preventative or prophylactic factor replacement or medicines, these individuals have a lifespan only a few years shy of you or myself. The average lifespan is in the 70s now, and these individuals are much healthier, their joints are healthier, and they're able to live a more active, normal lifestyle. And that's our goal. A lot of my young patients, we encourage them to be active in sports, albeit smart and safe sports, but sports nonetheless.
Yeah, that's terrific. Laurie, we talked a little bit about the clinics and the fact that you're not a clinic, but yet at the same time, how are patients referred to you? And when they are referred to you, talk to me a little bit about payment options and some of the things that might go into that strategy.
Patients are often referred by their pediatrician or their primary care doctor that they have symptoms of bruising or frequent nosebleeds. Other patients, if it's a genetic disease in the family, we will ask to see the siblings, the parents, and do a pedigree on them so we know it's familial, and we can kind of be proactive in seeing those patients. We accept all types of insurance, but we also have a foundation that we're able to help support patients that either don't have insurance or can't afford beyond what their insurance will cover. We have a social worker that works with us full-time, and she is accessible for our patients so that she can help them kind of navigate where they need access to the health care and to the insurance options.
Laurie, that's very important, the fact that, you know, the care is there, but nobody's really going to be turned away as a result of coming to your facility.
No, we don't turn anybody away.
Yeah, so that foundation is very important. So those of you who are out there, you may not have a blood condition, and you may just be watching this to learn some information about a loved one. But when we show you the website, maybe you should think about making a donation to the foundation. Dr. Schaefer, tell us about the SHE Clinic. What does that stand for?
Sure. So the SHE Clinic stands for Specialized Hematology Experts, but this is really just meant to be a cute name to highlight our women's clinic. So our women's clinic consists of pediatric and adult hematologists like myself and a local OBGYN whose name is Dr. Malik, who has special expertise in the care of women with complex bleeding and clotting disorders. And so we are a multidisciplinary clinic whose goal is to help women with problematic periods find solutions and ultimately undergo an evaluation to determine if they're one of the subset of women whose heavy bleeding is caused by a blood disorder.
Wow. Are some of these conditions genetic?
Absolutely. So we see a mixed picture of disorders at our clinic, with many of them running in families, but there's always situations where a condition may first be identified in a particular family member, and there are others that will evaluate the family and really maybe only find it in one member of the family.
We talk about genetics, and certainly in the last year we've learned a lot about how the pandemic particularly impacted different people of different races. And is that an issue? Are there people that have more blood disorder in a particular race than others?
Not particularly, I have to be honest. So, you know, von Willebrand's disease traditionally was identified in people of a Northern European background, but you can find it in people of various ethnicities. And I think that our patient population is actually quite diverse as well, where these disorders really don't have a particular ethnic predilection. The exception being factor XI deficiency, which is a little bit more common in individuals of the Ashkenazi Jewish lineage. But outside of that, our patients are from all walks of life and all ethnic backgrounds.
Ahead, if you have a blood disorder, should you get a COVID vaccine? We'll have that answer coming up. But first, if you would like to connect with Western New York BloodCare, you can find them at 1010 Main Street, Suite 300 in downtown Buffalo. For more information, you can give them a call. Here's the number, 716-896-2470, and online at WNYBloodCare.org.
We recognize that bleeding disorders in women are often underreported and undiagnosed. Bleeding disorders can leave women feeling isolated and unheard. With a focus on women's wellness and reproductive health, we provide care to our members of our community who are often overlooked. The SHE Clinic at Western New York BloodCare was established to give girls and women the opportunity for appropriate care, which may improve their quality of life. Knowing requires only a simple blood test.
Welcome back to your Hometown Health Connection. I'm John Sciullo, in for Samantha Latshaw. March is Bleeding Disorder Awareness Month, so we're continuing our conversation with Laurie Reger, the Executive Director of Western New York BloodCare, and Dr. Beverly Schaefer, a hematologist specializing in pediatrics and young adults. So Laurie, we talked in the previous segment about the importance of funding to get, and also to get the word out about bleeding disorders, and your organization certainly does need the funding, but you're also someplace that people can get comprehensive care and an education in blood disorders.
Yeah, we hold clinics. Typically, we'll see our patients on an annual basis with multiple providers. So the patients will come in, it's kind of a one-stop shop. They're able to see their hematologist, they see a geneticist, our dentists, our dietitian, our physical therapists. They meet with nursing. We do a lot of education to teach them how to manage their condition throughout their lifespan. And we help them to learn how to advocate for themselves and give themselves a voice and feel strong to talk to providers, some of their other physicians that aren't familiar with their disease, or even to legislators if they need to help us to pass legislation on a specific bill that would prohibit their access to health care. So a lot of education. So this whole comprehensive model, patients will come to us, they're there maybe a couple hours, but they see multiple providers, and our goal is to just keep them safe at home.
And it's a beautiful facility downtown on Main Street there. Laurie, tell us about some of the other specialists and experts that are on your team, and I understand you have a home therapy program.
We do. Part of our training and education for these patients that have to self-infuse, as Dr. Schaefer mentioned, is to teach them how to do this at home. So our nurses will, as young as 8 years old, start teaching these patients how to hit their vein and inject this medication. We have physical therapists that see our patients on an annual basis to make sure that there's not debilitating bleeds that are occurring in their joints. From you know, their toddlers learning to walk to their geriatric patients, to make sure that they're able to maintain their mobility and to do that safely. And with the youth, to make sure that they're strong enough if they do want to participate in sports. Do they have any weak areas that they would need to concentrate on strengthening? Our genetics counselor will meet with families that are looking for in the reproductive years to make sure they're educated on the effects and what would happen with a pregnancy. Our pharmacist, we have an individual that works with the pharmacist to make sure, with the patients regarding their pharmacy and their dosing. Our dentist will make sure that the oral health is maintained, because frequent bleeding in the mouth will occur. To make sure that they maintain good preventative dental health. So multiple providers that really help educate the patient all around. Our dietitian makes sure that they're maintaining a healthy weight, because the heavier they are, the more stress that puts on their joints. So
very comprehensive, and everybody's noted on the website, by the way, and you should check that out. We'll have that for you again if you missed it. So Dr. Schaefer, on the website, we talked about something that I saw that I think is very important in these days. Should somebody with hemophilia get a COVID vaccine or any kind of vaccine?
Absolutely. So yes, all of our patients that we serve, both patients prone to bleeding, patients prone to blood clots, even patients on blood thinners, are recommended to get all preventative vaccinations, including for COVID.
Now, it mentions that you specialize in pediatrics, young people. And so what types of blood disorders are young people more prone to? And while you answer that too, we'll do a little follow-up on the She Clinic, because I noticed during the break it's a great passion of yours.
Sure. So, bleeding disorders present differently across the lifespan. And I don't think that anything is more prescient in children than it is in adults, but sometimes it just presents differently. So oftentimes I really have to put my detective cap on as I'm evaluating young patients who have not had surgeries. They've not had numerous teeth extractions or had children yet. So you're really often going on a smaller bleeding, what we call bleeding challenges that they've had in their life thus far. I will say that blood clots and blood clotting problems are actually quite rare in children. That's something that's more common as we age. So I still evaluate those children as well, but that's actually something I see less often in younger age patients.
And then with the She Clinic, getting that education, and as Laurie just mentioned with some of the other folks that come through, getting your voice heard, and not feeling that there's a stigma to come to you or to any medical expert to talk about whatever issue they have. Why do you think people feel that stigma?
Sure. So I think women's health remains one of those topics where there's a lot of taboos. And there was a lot of thoughts about women maybe exaggerating their symptoms, or just women feeling that their complaints they were bringing up to different healthcare providers were being minimized. And there's also a little bit of a sense of this is how it is in our family, but really not recognizing that maybe the symptoms that they're dealing with on a monthly basis are well outside of what's considered normal. So the She Clinic is for several different reasons, but one of them is to evaluate women with heavy menses, because for women that have the true kind of medical definition of heavy menstrual bleeding, about 20 to 30% of the time there's a blood-related cause. It still means that many times it may not be a blood-related reason, but regardless, we really believe that these women deserve an evaluation because that may provide some unique treatments. And then from there, irrespective of what our findings are, it's our job to help women find strategies to make their cycles more manageable so that they can get on with their life and get on with their school or their education or their business. A lot of women's lives are really disrupted by discomfort and very heavy bleeding that interrupts their ability to do what they want to do.
Do you think maybe that sometimes speaks to human nature, that the woman is really sort of running the show and they don't take care of themselves, they take care of everybody else except themselves?
I think that's certainly part of it, but I think it also comes from a little bit about lack of awareness in the medical community of what's normal and not normal. And I think as a whole, we need to do a better job educating our young women and women as a whole of what's considered normal and not normal. So just to highlight a few, but cycles consistently lasting longer than 7 days is concerning. Women having to change a pad or a tampon more frequently than every 1 to 2 hours. That's a concern.
Right.
And there's a few others, but those are just a kind of a few big red flags to me.
Well, it's great work that you're doing and opening up that dialogue and that discussion for somebody that might be out there and has some concern about that. Don't be afraid to bring that up. Laurie, if someone needs to come to your facility, I noticed that your website really has some useful information to sort of answer questions, not only about what you offer, but you have patient packets, and we talked a little bit about insurance, and it's really presented in a comprehensive way. But does somebody have to absolutely be referred to come to you, or in somebody that might be looking at this program tonight thinking maybe I should call, can they just connect with you directly? Or
Absolutely.
do they have to go through the website? How is that process?
Typically they come through referrals, but patients, if they have questions, or there's individuals out there that would like to talk to one of our providers or talk to our staff to see, you know, I'm experiencing these issues. Is this something that should be evaluated? Absolutely. We, you know, we're available Monday through Friday. We do have after-hours call for our patients on an emergency, but we're really out there to be a resource for the community and to not only to other medical providers, but to individuals that don't know where to go and they're experiencing some of these symptoms. So we're happy to be there for you.
Well, it's, as I said, a very comprehensive website. And if you're like I am, paperwork challenged, you make it a lot easier. And that's really something that's helpful, I think, in the process. Dr. Schaefer, what drew you into becoming a hematologist?
Sure. So, you know, honestly, early experiences in volunteering with children with cancer and blood disorders was one of the things that opened my eyes to this as a career choice. But it was really in my advanced training in hematology and oncology where I really became attracted to the detective work involved in being a hematologist. My other hat is as a pediatric oncologist, which I also tremendously enjoy, but I really love being a consultant, having a set of symptoms, having a set of labs, and trying to decipher all the pieces of the puzzle, if you will, to try and come up with a unifying diagnosis for the patient.
And does some of that come with the type of blood that a person has naturally?
Do you mean like their blood type?
Yeah.
It does actually. So yes, there are differences in our blood clotting system, if you will, depending on our blood type. So that's just one aspect. Our ethnicities alter kind of some of the components of our blood. So there's 1,000 different things that make our blood similar and different between one another.
Is one type of blood better than another?
No, absolutely not. They all work wonderfully, and be glad for the blood type that you have, whatever type you have.
It's interesting to find out how much you can learn about the human condition by simply taking a blood test. It's fascinating to me, and then it speaks to the detective work that you go through.
Absolutely. So I see patients who have 1,000 different abnormal labs, and I have to admit that some of the laboratory testing that we do in specialized blood disorders is a little bit finicky. And I say this because a lot of patients come to me incredibly distressed, but I have to share with them very honestly that sometimes their blood tests may not reflect a problem within them, but a lot of our blood testing is actually very susceptible to some issues in handling and processing. So we always repeat it on several occasions to really get a sense of if this is true, or maybe just what we call spurious, or a little bit of a sensitive to the lab process.
Just in our few remaining moments, if I go and get a checkup, I promise I'm going to do that. Is it something that somebody should always get their blood work done when they get a checkup to see if something is happening along the way?
You know, that's a little bit of a different question. I think, you know, primary care physicians are often doing blood work in children and adults, screening for things like diabetes and cholesterol, and I think that's incredibly wise. In my practice, however, I do not think that a lot of the things that I'm looking for, you need to screen for unless they're driven by symptoms first.
Okay. All right, well, Dr. Beverly Schaefer and Laurie Reger from the Western New York BloodCare, thanks for joining us on your Hometown Health Connection. I think you've enlightened us all with everything we need to know, and really appreciate your time.
Thanks for having us.
Thank you. If you or a family member need the services of Western New York BloodCare, you can find them at 1010 Main Street, Suite 300 in downtown Buffalo. For more information, you can give them a call. Get a pen and paper, write this number down. It's 716-896-2470. And here's that website we talked about on the program. Find them online at WNYBloodCare.org. Whether a routine blood test shows something more complicated or you need specialized treatment for a chronic condition, don't put off getting the help that you need. I'm John Sciullo in for Samantha Latshaw. Thanks for watching. Stay safe and be well.
We recognize that bleeding disorders in women are often underreported and undiagnosed. Bleeding disorders can leave women feeling isolated and unheard. With a focus on women's wellness and reproductive health, we provide care to our members of our community who are often overlooked. The She Clinic at Western New York BloodCare was established to give girls and women the opportunity for appropriate care, which may improve their quality of life. Knowing requires only a simple blood test.
Buffalo Healthy Living magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living magazine all over our hometown or go online anytime at buffalohealthyliving.com. A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living magazine and its sponsors.